Hi, this is Dr. Tom Rogers at Performance Medicine coming to you with the weekly podcast. Today we're going to talk about something very interesting with metabolism. It's concerning weight and inflammation and insulin resistance. And it's a marker that we use when we do our Cleveland panel called uric acid. Now, a lot of people associate uric acid with gout and kidney stones, which is true because when your uric acid is high, you're more predisposed to have this painful type of arthritis, especially in your big toe, sometimes ankle and knee, sometimes the smaller joints, called gout. If you've ever had gout, you'll know what it is because it's a very, very painful, red, swollen joint. And usually it's the big toe. We see this a lot. There are good treatments for it. But the basic cause of it, which you can be predisposed to it by genetics, there's some mutant genes that may cause you to have a problem with metabolizing purines. So it's all about purines. Purines are organic molecules that are found in a lot of foods. It's also found in your body, but mostly when you think about it, you think about foods, especially foods like red meats and shellfish, and also alcohol. These are things that can precipitate a gout attack. But really, I'm not going to talk about gout. I'm going to talk about uric acid as a biomarker for inflammation. And the reason I'm talking about this is because one of my physician associates, Fran Wilson, just read a book by Dr. Perlmutter. And he's one of our frequent lecturers in integrative medicine. He's a famous neurologist that wrote The Grain Brain. So he's really into staying lean and fit and avoiding inflammatory conditions like heart disease, cancer, and as a neurologist, dementia. But it turns out that, he's really big on keeping that uric acid level down. The normal is anywhere from like 3.5 to 7.2. He likes to keep it under 5.5. That's really the optimal level of uric acid in your body. So it does turn out to be a marker for a lot of bad things. One of the worst things you can do to raise uric acid is consume fructose, and not really in the form of fruits, but more in the form of high fructose corn syrup. Alcohol does it, and like I say, the things like red meat and shellfish and alcohol, especially beer. There's some natural things you can do to lower that uric acid level. And if you do have a lot of gout, then there are medications that we use to do it, like allopurinol on a daily basis and colchicine for acute inflammation. Colchicine is an interesting drug. We used it a lot in treating COVID, and it may be a protector against arterial inflammation as well. So I think there's going to be a lot more use of colchicine in the future as we find out more about it. One problem with colchicine, if you take too much of it, it gives you bad diarrhea. So you got to really watch it. So it turns out, though, that an increased uric acid level is almost always increased with your BMI, your weight per height. And what happens when you get an increased uric acid level, it decreases your nitric oxide, which is a very important gas that decreases insulin resistance, hypertension, and you'll have reduced blood flow to organs if this nitric oxide level is low. That's one reason I love the drug tadalafil, Cialis, to increase your nitric oxide for other reasons than ED. So you want nitric oxide to be high. You want uric acid to be low in general. There are exceptions to that rule. So what do you do? Well, there's some supplements you can use like quercetin, vitamin C, luteolin, DHA, which is part of your omega-3s, and chlorella. I love that flavonoid chlorella. I'm starting to use it just by adding a few drops to water every day. A lot of beneficial things to that plant pigment called chlorella. Um, and again, stay away from high fructose corn syrup and processed foods. A lot of this relates to insulin resistance. And that's why Dr. Perlmutter recommends, as I do, that you may want to get a continuous glucose monitor for a while and see what kind of foods and drink raise your sugar levels. He really thinks you ought to have a fasting blood sugar below 95. And for most people, that's kind of hard to do. Um, there's certain drugs that can increase your uric acid, and some of these are useful. Some of them, the benefit versus the cost you have to weigh, like low-dose aspirin can do it. I recommend low-dose aspirin to most people, but it can slightly increase your uric acid, usually at higher doses, though. Even testosterone, you have to watch your uric acid levels. I don't find that to be a problem. Topamax can do it. Brilinta, which is a blood thinner, can do it. Omeprazole, which is a medicine that I really do not like you to use chronically. It can raise it. Even niacin, too much niacin, which can flush you, can raise your uric acid levels. So you have to be careful with that. L-Dopa that we use for Parkinson's can do it. Certain diuretics can do it. That's why you don't want to treat somebody that has gout and high blood pressure with a diuretic. It'll precipitate gout. Beta blockers can even do it. You know, beta blockers are great, but they can have a lot of side effects as well. But it turns out that, of course, insulin resistance, waist circumference has a lot to do with your uric acid levels being higher. Your gut, of course, as Dr. Perlmutter will tell you, is the most important thing to start out with, because again, we're talking about metabolism of these things that are in foods. So if you do have a high uric acid level, you may want to cut down on red meat consumption. Organ, like liver and kidney is really bad for that. And it's good for certain people with low iron, but bad for people with high uric acid levels. Purines in the red meat are, of course, an issue. They're not really good. The older I get, the way less red meat I get. And I also have another marker to tell you whether you should be consuming a lot of red meat, and that's a TMAO marker that has a lot to do with your gut bacteria when I draw your Cleveland. So we'll go over that when you come in for your Cleveland. Uric acid does have some functions. When food was scarce back in the day, you needed it to survive because it keeps weight on you. But nowadays, with food being everywhere 24/7, it gets too high, and the risk really outweigh a lot of the benefits of having a high uric acid level. Some other things you can do, and one of the things I do every day to keep, I don't have gout, but to keep arthritis and inflammation down, are tart or sour cherries. I eat them every day. And it turns out red wine is good for keeping that down, mostly in women, though. Coffee is really good, too, to lower your uric acid level, but mostly in men. Isn't that interesting how that goes for that? But anyway, you need to think about, Dr. Perlmutter talks about naked carbs, and that means consuming high glycemic carbohydrates by themselves. That's particularly bad. If you do eat the carbs, you need to have protein or fats with them. It kind of blunts the bad effects of the carbohydrates down a little bit. And remember, you could survive with no carbs. You have to have fat and protein. That's why I like a low-carb, higher good fat, moderate protein diet. A lot of people overconsume a lot of foods that have purines in them. And again, you may be able to tolerate them, you may not. Some people do better with a plant-based diet. Certainly, if you have gout, you will. And leave the beer off if you can. So check the uric acid. Again, it's in our Cleveland panel. There's a lot of other useful inflammatory markers in there, but this is just another one of them that we use to keep inflammation out of your body. Look at your gut, look at your biomarkers. Lower your carbohydrates, lower your waist level, lower your BMI, stay thin and stay healthy. Increase muscle, less belly fat. Do all these things and certainly measure that uric acid level. Thank you. This is Dr. Tom Rogers, the Common Sense Doctor. Come in the office, get a Cleveland heart panel, and we'll talk to you about all these things. I'll see you next week.